morning, Mrs. Smith. My name is Olivia. I'm a PMW student, and I'm going to, actually, after reviewing your chart, you are scheduled for a NG tube insertion, and this NG tube insertion is going to supplement some of your nutrition and provide some added nutrients for you at this time. So to begin this process, would you have any questions right now?
No.
Okay, so before I get started, I'd like for you to tell me your full name and birth date.
Sam Smith, 9/10/14.
Okay, perfect, Sarah. Thank you so much. I'm going to raise your bed for proper body mechanics. So Sarah, this procedure is going to be very uncomfortable, unfortunately, but we are going to get through this together. We have a few tricks to hopefully minimize the discomfort. So I'm raising the bed to about 45-degree angle. And then we're ready to get started. So I'm going to provide you with a Mrs. Basin, just in case you have to spit out, some tissue because the natural processes for the tears may come out. I'm going to provide some protective covering over your chest. And then I'm going to, so this is the NG tube that's going to go down your throat. I'm going to measure first from your inner part of your nose, or your eye actually, and come around your ear. Let that go. Down to your xiphoid process. Up here. I'm going to take this off. I'm going to put a pair of gloves on. Pair of gloves. Okay, so before I get started, I'm going to loop the tube about 2 to 4 inches. We'll throw it in the garbage. And then I'm going to ask you to tilt your head back, and I'm going to insert through the nostril, but before I do that, actually I'm going to take a step back. So now I'm going to back up a little bit. So I'm going to lubricate the tubing. And then I'm going to ask you to occlude one side of your nostril and the other, and then you tell me which one would be the best that you're breathing out from. Okay, so we've decided that the right side is going to be the best option for this procedure. So I'm going to insert in the nostril, upward and back, and then I'm going to use my tongue depressor. I'm going to make sure that the tubing is aligning to the back of the throat and everything looks good. So right now I'm going to grab a piece of tape. I'm going to secure it to the cheek. And at this point I could, actually I'm all over the place with this. I'm going to offer the patient some water, and Sarah, I'm going to ask you to take a sip of water each time I kind of put the remainder of the tube down your throat. So we're going to just pretend that she's holding the water, and that she tilts her head down, please, and then I'm going to advance the rest of the tubing up until we reach the tape. Now I'm going to secure it to the cheek. measure. Measure how long we have. 21, I would document that so that when we came back in within 24 hours, if it's longer than what it was, then we have a problem and we need to make some adjustments. But since that's good, I can now secure, actually, I'm going to check. So there are two ways to make sure that we are in the belly. We can have imaging come in and check that for us. Or in this case, we are going to check. I'm going to aspirate. So I will pull the suction. Gonna pull back. Clamping. Let it come out. Apply it to the pH paper. And if I see that the pH is less than 5, we know we're in the gut. So I'm going to reclamp this. We're good to go. We can permanently secure to the nose. So we use a 4 inches of tape. I'm going to apply the tape to the bridge of the nose. And I'm going to wrap this around the tubing. I'm going to add another piece of tape. Sorry. Put it on the top there. Still doing okay, Miss Smith? Good. Now I'm ready to apply the suction. And I'm not posting that out. Sorry. And I'm going to put it on regular. Make sure that it's above the heart level. And use the rubber band to secure it. You can turn your head opposite me. Perfect. And I'm going to secure to the gown. And that would complete the NG tube insertion. So now we are going to start again. Hello, Mrs. Smith. My name is Olivia. I'm here to remove your NG tube. So that's great news. How are you feeling today? Good. Can you tell me your name and your full birthday? Okay. Now I'm going to put my gloves on. Okay, I'm going to start by removing the suction. I'm going to turn it off. Remove the suction. I'm going to flush 10 ml of regular saline. Okay, well I misplaced that. Alright, and now I'm going to Now I'm going to remove the tape gently from the patient. Okay, Ms. Smith, I'm going to ask you to take a really deep breath. And when you do that, I'm going to gently remove your tubing. Take a deep breath. Good. And put the tubing here. We're done with that. I would also be checking for how many liters or that was in the tube here in the vacuum, and document that. And then I would ask the patient, how are they doing? Good. And we're ready to lower the bed. Lay your back flat. Lower the bed. And that completes the NG removal.